and welcome everyone to another Women's Health Tech Wednesdays. My name is Nina Joshi, and today I am very excited to bring on our guest today, Andrea Diamond, founder and CEO of Diamond Nutrition Counseling. We love questions here at Women's Health Tech Wednesdays, so please use the Q&A feature at the bottom of the screen if you have any for Andrea, and I'll make sure we get to it towards the end of our discussion. And so with that, we'd like to formally bring out our guest. Andrea, thank you so much for being here today.
Thank you so much, Nina. Thank you for having me. This is really a pleasure.
Of course. We're really excited to learn more about you and kind of your founder journey. So maybe if we could kind of kick things off, would love if you could tell us a little bit more about yourself, your background, and really what inspired you to create this company.
Thank you. So a little bit about me. I am a registered and licensed dietitian nutritionist and company CEO of Diamond Nutrition Counseling. And what got me interested in this business originally was I was terribly overweight and out of shape, and I decided to do something about it. And that really started my journey.
Mm-hmm. I love that there's like that personal connection that you have to that.
Yeah, so I have a master's of clinical nutrition and I am and also advanced clinical training in the counseling arena, which really was my passion for getting into the nutrition field.
That's incredible. And then what inspired you to create your own company?
Well, great question. What inspired me is decades ago, I was working in a health food store. And I just knew that the information or misinformation that was being disseminated was something was wrong there. They were not qualified professionals. And I said, darn it, I'm going to do something professional about this. And I decided to go to school for it. And I consequently went on to get a master's and advanced degrees.
That's incredible. I definitely have some questions about things I would like you to debunk, but we'll save that for later in the conversation, because I think the misinformation piece is so rampant, with social media, even within, a health food store setting. So I can definitely see how, being able to have a service that can help combat that is really valuable.
Absolutely. In fact, most people don't really know what a nutritionist does, and our clinical training, which is really extensive, and really what we can offer people. And one of the things that really I was passionate about was also making nutrition counseling services more accessible and really educating people as to who we are, what we do, and that we're really medically trained. So in the clinical arena, so we can really hopefully offer some wonderful professional assistance instead of, like you said, all that's out there. It's so hard to make sense of what's true, what's not true. We're bombarded every single day with lots of information. Some of it is evidence-based and some of it is absolutely not.
Yeah, I can imagine it's quite tricky to navigate.
Really
but kind of on that note, would love if you could share a little bit more about, what is Diamond Nutrition? What services do you offer, and what goals are you hoping to accomplish with this company?
Sure. So Diamond Nutrition Counseling, we provide private counseling to and classes, but mostly private counseling to the patients of, I would say, over 700 physicians in at least 2 health systems. We really provide a turnkey comprehensive service to those health systems. I realized years ago that they were very interested in nutrition services and having a nutritionist for their patients. But when it came to actually finding a nutritionist and hiring a nutritionist and all that involved, and they really were not equipped to do so. And so we found ourselves with a niche to provide really a comprehensive service where we not only provide the nutrition professional, the registered licensed dietitian, to counsel their patients on just about anything you can imagine, nutrition and medically related, but also to provide like an admin side to things. So we have a whole admin team as well as a registered dietitian team. We have 25 nutritionists now. We have about 25 admin professionals, really virtual all over the world, actually. And so we are able to offer really a whole staff to a physician suite so that they don't have to. And that was the niche that we found.
That is incredible. So really just, that's so funny because I was just going to ask you, how are you kind of solving this gap that you've seen within the healthcare space in a creative manner? And I think the fact that you've really been able to take all of the, the paperwork, the admin, like the logistics side kind of off of physicians' hands and really ease their burden, definitely sounds like a differentiator.
Yes, absolutely. And it's a great relief to them. So we are considered a private vendor, and we and their tech team have really created a fantastic kind of workflow that we have embedded our services within their referral flow, so that it's a very nice workflow of physician refers to us. We match that patient with one of our nutritionists, and they counsel them. And now we're 100% online. We're not always, but COVID did that, and we were able to really take advantage of that, actually. And then we kind of loop back to the physician, so we're really a part of that collaborative team. And the patient knows that. So it's been a very effective, exciting kind of loop to be in that healthcare loop, even with their physician. They know that their physician is going to get a progress report and so on. So, and then we also can communicate directly with the physicians. So it's really been a kind of a unique setting.
Absolutely. And I'm so curious, and I think you kind of answered this. I mean, it's just so evident, like what that partnership between like you and your services and the physician, how that can be very beneficial. Was that something that you kind of always knew you wanted, as, to kind of work through a physician and their practice versus just, direct to consumer? Or was that something that you kind of learned along the way?
Yeah, great question. I actually worked with physicians since very early on in my career, and really wanted, again, to improve access. That's one of our goals, is to really improve access. And so I remember in my early days, I would be counseling patients. I was wearing all hats. I was the business hat, I was the counseling hat. And in between patients, I was running to other physicians and marketing my services. So anyway, and that's a little bit of how I began to develop relationships and expand and so on. I think there was another part of your question that, if you want to repeat that, I'm not sure I answered.
No, you did. I think it's just about like, what made you kind of decide to start with, that physician entry point versus just like directly marketing to, the consumer. But I think you kind of answer that. Just, I could imagine wearing a lot of hats for a long time can get a little bit exhausting.
Yes, exactly. And actually, I've been in the university and corporate arena also, in terms of teaching and so on. So I did deliberately choose to, it was really very gratifying to do one-on-one counseling. So the physician suite was really a natural kind of place to access.
Absolutely. Wonderful. Well, I love if now we could kind of pick your brain a little bit about being a founder, because I know that comes with its own, I would imagine, learnings and barriers and things that you've really had to learn about the industry and yourself. So would love if you could, share with us a little bit, what did it take to kind of start just a business in general? I know you had this idea, you saw this problem, this pain point. Where did you start from that? How did you kind of connect the dots between, I see this problem and I'm kind of the person that can help solve it?
So I really found that nurturing relationships over several years was absolutely key to this. One of the health systems, for example, they wanted to hire a private vendor, but they're very used to their pathways of how they refer to other clinicians. And so they wanted in-house. But the need for nutrition services by physicians was expanding. And so the pressure was on. So finally, after about a year or two, they finally broke and said, we're gonna try this out. So I would say that it's really kind of really persevering in those relationships, knowing that they really wanted to, but didn't have the capacity to draw from their internal resources. They were really stretched. So I really proposed a pilot. And I think that that was an effective way to say, no obligation. Let's see if it works for everybody. And sure enough, it did. And one thing led to another, and word of mouth. And we expanded into all the different practices. So we're covering at this point the primary care and specialty care practices of both health systems, which has really, really been very gratifying. And that's really how we've grown. So
that's incredible. That's amazing. And I like that you're kind of focusing on not just primary care, but also kind of broadening your reach a little bit too.
Absolutely. In fact, to one of your points earlier, although we're in the health systems right now, one thing we're doing with HITLAB, and kudos to an amazing, amazing team at HITLAB who's really helping us to create, and we're about to launch a new part of our business that's really going to target the consumer and target employers most likely. One of my passions is looking at the employer space because it's an area where even when people are compromised health-wise, it just takes such a toll on you. You may be familiar or not with the terms of presenteeism. We certainly know absenteeism, quality of life, and just their ability to be present at their jobs and to do a good job. And certainly that translates into a company's bottom line. If you have a diabetic patient, for example, who misses many days a year, we now know from the literature that if a diabetic patient really is not able to, or doesn't know how to take care of their state effectively, it can actually cost an employer up to $85,000 to over $100,000 over the course of a lifetime. And so that really impacts a bottom line for a company. So we want to, of course, target and improve the lives of the employees, as well as have it be a win-win all around.
Absolutely. That's really interesting. I mean, I can definitely see that relationship. So I think it's really great that you're kind of, tackling that component of it as well. How incredible. Well, you had kind of mentioned a little bit earlier about how, relationship building was just so important to you, that kind of really got you started. Would love if you could also share, with your wisdom kind of with, founding this business, what other habits can you identify that, have made you successful in starting a business that others can also take when they kind of think about starting their own business?
Absolutely. It's been a tremendous learning right from the get-go. I'll start with that. And things that I've learned along the way that I'd love to share. One of the earliest lessons learned was to respond quickly to people. If you have an email, a phone call, something that where somebody needs to be in touch with you, don't let it sit for 2-3 days. It's just very, very important. It shows that you value their time, that you value their concerns, and do that consistently, and that will be, believe it or not, that's really powerful. Another is that I learned is to really commit to a daily structure of activity that actually moves you forward. We can have a day that is full of busyness, but unless you are really tackling those things that will move you forward, then you are kind of spinning your wheels, and it's easy to procrastinate. But and so a lesson within that is do your toughest work earlier in the day.
I like that.
Toughest challenges, just get it done, check it off, and then you've moved yourself forward. Another is cultivating leadership. I think that leadership, I strongly recommend get yourself a mentor, and somebody who exudes successful leadership. There's so much to learn about leadership, and there are a lot of aspects that are not intuitive. So read about it, learn from people, have a mentor. And I would say another, in a more practical way, is keep great records and track everything about your business, because one of the things that I am finding, of course, all along the way in this particular business is people want to see outcomes. How successful are you? And if you can't show that, that's going to really set you back a little bit. So any metric, any outcome that you can track is really a powerful tool for moving yourself forward and communicating with other people.
That, I don't know if it was obvious, but I was writing all of this down. I think that is all such great advice, I think, for founders, but I just in general. So thank you so much for sharing that with us.
Sure. And then there's one other thing I'll say that really
Yes.
helped me as a turning point in my business. Know your strength. You know, as a business owner, I think it's so tempting to, again, wear all hats and just stay with that for way too long. And that does not move you forward. So know your strengths, know what you're not as great at, and bring other people on or outsource it. And take that leap after you calculate, of course, that it's a wise move to do. Speaking to other people, an accountant, an attorney, you know, a mentor, and so on. But I think that is, at one point, I'll give you a little bit of a story.
Yes,
I actually had to leave the country. I had a very ill spouse at the time. And so I said, okay, I can either close up my business or I can hire somebody else, which I was absolutely petrified to do, to help out and keep the business open while I had to be away. So I chose the latter, and it was the greatest thing I ever did. And it really taught me that, you know, the right people, of course, can help you leverage. And I'm sure you've heard that before, but it took everything for me to let go, do what I did best, and hire the right people. So
I love that.
Yeah. So that was a real turning point for me. And then it gets easier to do that again and again. And then you realize that you are not always on the front line anymore, and you can really hold on to your vision, live your vision, figure out how to strategize to you know, how do I back out of that vision to strategize and meet my goals?
Absolutely.
Keep your eye on the prize. Yeah.
Eye on the prize. That's what it's all about.
Yeah.
And I love you'd mentioned something that I really like about, you know, being able to just kind of like loosen the reins a little bit and kind of bring people in. I feel like, and I would imagine this as a founder, but also just in general, you know, when this is your baby, your work, it's very easy to get very protective and to, you know, want to wear all the hats. So I can imagine that it is really hard sometimes to let other people in. But I think just in general, that's very good advice of just, you know, it's okay you don't have to be every part of it to still, you know that you're doing a good job in moving the business forward.
Exactly. And that person that you bring in does not have to be perfect. And it's a learning for everybody, but it's also, think of it as a relief for yourself. Like, wow, you can really move this forward now.
Absolutely. That's incredible. I do want to get into picking, like, you know, getting your take on some of these trends that I've been seeing. But before we jump into that, really wanted to quickly ask you for, you know, folks in the audience that are maybe starting their, you know, fundraising journey, starting to raise capital. Would love if you could share a little bit, you know, from your perspective, how, you know, any tips that you have when it comes to raising capital. How you were able to kind of maintain funding kind of through the course of the business to where it is today.
Sure. So I had advice early on that from a very successful entrepreneur in the healthcare space, actually, and he said, self-fund as far as you can go. So that's the beginning. Beyond that, just know that there are resources out there, certainly, and that's where it becomes very important to have a mentor and to have professionals on your team who can really guide you. Is this the time to go for funding? Which direction? How do I do it? The HITLAB team for me has been amazing in that way, but I will say I haven't yet gone for funding. So I've kind of bootstrapped it, and then what we did was we hired as we grew, but we knew that the revenue coming in would cover that hiring. So we kind of did it in a stepwise approach in that way. So I have not yet gone for funding, but now with the project that I've done with HITLAB, it is at a pivotal point where it looks like that would be a next step. So I don't have a lot of concrete advice beyond that.
No, that's good. I mean, I think I manifested that for you, I guess, when it comes to funding, but I like it's just, you know, the general principle of just, it's okay. You don't have to do everything at once, just a stepwise approach that you can
Absolutely.
take, I think, can also be very, very valuable.
Absolutely. In fact, growing slowly was also a lesson I learned early on, because as you know, the statistics for small businesses failing can be significant. So in any case, I think that that's one of the keys, is to grow slowly, and then you really get to know the milieu in every way as you're growing. Yeah.
Absolutely. Awesome. Well, now I really want to ask you, so I've been, I'm sure that you probably get this a lot too from patients who kind of come to you saying, I heard about this new food trend. I heard about, this, I hear gut health hacks and things like that all the time. What are some, trends that you're seeing, or misinformation, things that, have been deemed healthy or unhealthy, that you would like to help us debunk right now?
Okay, great question. I would say be very careful about your sources. Really know that it's coming from an evidence-based source. Question new what seems to be research coming out. Make sure it's evidence-based. And then beyond that, we actually, I'm very excited to be getting into brain and gut health, and they're very much connected. And then really bringing in, I'm very passionate about not only offering nutrition advice, but the counseling piece is, to me, just as important. So when we hire, it really has to be somebody who really has expertise in that area. So one of our goals is to help someone advocate and create their own personal health journey. So it's not just eat this, don't eat that. But we are, to your point, offering classes on just about anything you can imagine. But one of the core areas is this brain and gut health area. We now know that the gut is the hub of everything, not only physical but mental health as well, behavioral health, and so the avenues that really are all actually connected to a core is so absolutely fascinating. And so I'm really excited to be offering those kinds of classes as we kind of launch this new part of the business. Yeah.
I love that you are really like advocating for just everyone has their own individual journey. And I had no idea that there was a mental health and gut health connection, because I've heard about gut health being very important, but I didn't know that it also had implications to behavioral health. That's very interesting.
Absolutely. And I really believe so strongly that people, they don't realize how much we can take responsibility and in any case, how nutrition, diet, exercise, again, we've heard it, but we go deep on these issues, and so we're really excited to be able to offer that kind of thing.
I love that. We have some questions from the audience. I want to make sure that we have some time for that. The first question, and it's funny because you actually alluded to this a little bit earlier about, just the varying types of roles and different definitions. We have a question wondering the difference between a nutritionist versus a registered dietitian.
Very good question. A registered and licensed dietitian, actually, dietitians don't have to be licensed in every single state, but they do have to be registered. A registered licensed dietitian or a registered dietitian has to go through a very intensive clinical education and internship over several years in the hospital setting. And so we're really science and medically based. A nutritionist can hang their shingle and just say, I'm a nutritionist, so they may or may not have had that background. So you really want to check and make sure that they have gone through the national protocols for becoming a registered dietitian.
That's incredible.
Okay. It's also called registered dietitian nutritionist. I mean, you'll see a couple of different labels in different states.
Gotcha.
Yeah.
Very, very helpful. It's very good to know. And then we also have a question about, your company. How diverse is your panel of nutritionists as it relates to race, ethnicity, language, etc.? Knowing that, diet plays a really important role, as it relates to some of these factors as well.
Yeah. So we have several Spanish-speaking nutritionists on board. We even have a nutritionist from Argentina, which is really exciting. So we're really global at this point. We have 25 nutritionists, so the breadth of their experience is unbelievable. Just about anything you can think of. We have specialists in diabetes, wellness issues, also, of course, weight management, GI, eating disorders. My goodness, the list is really extensive. Renal nutrition, kidney health is one of my passions as well. It's a very complex diet, and people who are really struggling with this don't realize that there's so much out there that they can do for their concerns. In any case, but the breadth, so we see just about everything because we have people on our team who have just, again, a wealth of experience, and throughout the really from children to the elderly. So, and we also counsel families, and that's really exciting too. So we do pediatrics as well, pediatric and adolescent nutrition.
Oh, nice. That's really good. And then also last question around, so, when you bring on a patient into this program, typically, how many sessions does it take to complete the program? Is it something where there's, a start and an end point, or is it really just something that is just, dependent on the particular person and really what that journey looks like?
It really is. It's really individual. We really try to tailor it to each person, and we do a lot with insurance coverage. So we work with a person to see whether their insurance will cover, and sometimes that governs how often they'll come in, how often they follow up, and so on. But we certainly encourage follow up. To be honest, I think that it really depends on how motivated and ready somebody is to really jump on a health journey. So we really try to establish that with them, and we also really try to match, again, that person with somebody who we feel really meets their needs. Yeah.
Well, that's incredible. I know we're at time. I just wanted to thank you so much for taking the time to chat. I feel like those 30 minutes just flew by so quickly today.
They really did.
Yeah. It was so much fun. I really, really appreciate you just taking the time to share not only your founder journey with us, but also just some fun little facts that we can take with us. So really wanted to thank you.
Absolutely. Thank you so much for having me. And I just want to leave everybody with, are we still on?
Yeah, we're still on. Go for it.
Wonderful. I just want to leave everybody with, way in the beginning of my career, I read something fantastic. It was a woman who was successful at that point, but she said, just know that you're successful even if you don't have a penny of income yet, because the fact that you're in the ring is success. The people who get into the ring are so far along than people who never get into the ring, and have the courage, as Brene Brown says, dare greatly, have the courage to succeed, have the courage just to get into the ring. So keep on going, persevere. When one door closes, it's only because there's another even better one around the corner. And that's really a key, perseverance. So thank you very much for having me. It was great fun. Good luck to everybody. Good luck. Take care. Thank
you so much, Andrea. And thank you for those words of wisdom. I think that is always such a great way to not only end our session, but I think just really driving it back to just perseverance and the fact that you have an idea and you're moving forward. Baby steps are still steps. So I love that.
Absolutely. It's the only way to go. Baby steps.
I agree with you.
Thank you, Nina. Thank you, everyone. Good luck.
Thanks, Andrea. And be sure to check out our next session next week with Novartis. Wanted to give one last huge shout out to Andrea. We also have our Innovator Summit on June 30th. So please be sure to check that out. All the information is in the chat. Wanted to thank our sponsors, thank Andrea, as well as thank you all for another session. See you next Wednesday. Bye, everyone.